Hello, my name is Elena Jordanov. I'm the APHA Environment Section Secretary, and I'm joined by a speaker from the APHA Annual Meeting, Alton Reid. His presentation, How Do Neighborhood Assistance Efforts Impact Health and Place, was really impactful, and so we just wanted to learn more. Alton, I'll turn it over to you. What do you want others to know about this topic?
Thank you. Just to do an introduction, my name is Alton Reid. I'm with the Environmental Protection Agency's Office of Inspector General. The presentation was based off of my master's project that I did at Drexel University in 2017, not to date myself, but essentially the topic that I did was housing and housing health. It's about the built environment and just aspects of the built environment that impact people at the individual level. From a public health perspective, I want people to think about housing a little bit differently because we spend a lot of times in our homes and in workplaces and just within the built environment ourselves. A lot of people don't realize how much that really impacts you. They kind of just think of the house as a place of just, respite where I'm with my family, I'm relaxing, but there are things within your home that do impact health. When I did that topic, I was trying to help out the community of Philadelphia where I was living when I was this master's student. But I want people to just generally think about housing more and just the implications of what it could do for you, not only in the short term, but also in the long term.
So in what ways does your work advance health equity?
So that work that I did when I was at Drexel was based off the fact that we were trying to impact housing within the Philadelphia region. Actually, that's a little bit of a story for me. When I was at Drexel, I actually lived in that area that was getting the houses fixed as a student in the 19104 zip code of the Promise Zone. And the whole aspect of what the research was for was we wanted to see health outcomes relevant to houses that were getting fixed up and being remodeled or like upgraded versus houses in the general vicinity that weren't having the same upgrades through the Home Preservation Initiative, which was a housing program. It helps with health equity because compared to some socioeconomic status, high socioeconomic status areas, that area was pretty low income, so they didn't have the resources to get their homes fixed. And we were just trying to do that project to kind of show that there was an importance to this and have data to back up a community brief and an issue brief and just different grant funding opportunities.
That is really impactful work. How can viewers learn more?
So I'm not on there, unfortunately, anymore, but I think one of the best resources you could use is you go on Drexel's website on the Urban Health Collaborative. The Urban Health Collaborative has the issue brief that is there, and it also has different groups that are still doing that type of work with housing. It should have those individuals who are involved. And I do believe even at the local level, like at your public health association, they should have things relevant to housing and policy. I think the best way to kind of do that is to either look in the academic aspect and see if there's nonprofits like Habitat for Humanity or Rebuilding Philadelphia for Philadelphia, for example, or just other type of nonprofits that do the type of work. And then, try to see if you could either do it either academically or just as a normal policy thing, or just try to get involved in any way, shape, or form.
Those are really good tips. So we will go ahead and add any links that Alton suggests for us down in the description below. And thank you so much for teaching us more about how to advance health equity in terms of housing.
Yeah, thank you. Appreciate the time.